Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
what is the treatment or different drugs used in hyperlipidemia? Treatment of hyperlipidemia. In the treatment of hyperlipidemia, first we have HMG CoA inhibitors. HMG CoA inhibitors are nothing but these are also called as statins. HMG CoA inhibitors include lovastatin, pravastatin, simvastatin, and these will inhibit the enzyme HMG CoA, and thus they will decrease the because they will inhibit HMG CoA, and HMG CoA is the rate limiting enzyme in cholesterol synthesis. So they will decrease cholesterol synthesis, thereby because of decreased cholesterol the liver starts producing more LDL receptors, so there is increased hepatic LDL receptors are present, and there is also decreased VLDL is also seen in the VLDL production is also decreased. So in these patients, the main side effects of these HMG CoA inhibitors are patients with HMG CoA inhibitors can present with myalgias or myopathies. There can be increased transaminases have been reported, and also increased diabetic mellitus risk is also seen in these patients who are on HMG CoA inhibitors. Now, what are the uses of these HMG CoA inhibitors? They are used in conditions where there is elevated LDL cholesterol is elevated, like hypercholesterolemias. In them, we can use this HMG CoA inhibitors like lovastatin, pravastatin, simvastatin.
thank you and thank you for watching.